All right, so welcome everybody. For those who have been following, those who are new here, I've been documenting my breast reduction journey. Today's Friday. I had my surgery on Monday, so is this 5 days since? I don't even know at this point. I need to wrap this up so I can go back to sleep. I've been sleeping, popping pills, pissing, eating, and repeat. Those four things. I kid you not. So let's get this going. I can't even talk. So day of surgery. I was told to get there at 9:15 a.m. and I was told that I would be leaving by 3 o'clock. The actual surgery is between 3 to 4 hours. Yeah, it's a kind of long surgery. So I got there at time, got checked in. Also, no eating before because it's general anesthesia, so no eating after midnight and no drinking after 6 a.m. So I was really thirsty from the get-go because I didn't wake up early to drink. I was like, I'm not doing that. And then I got really thirsty. But the actual check-in, I got there about 9:15. It was pretty smooth, and then we went into, the waiting the pre-operation room, got changed and everything like that. And then the multiple different types of medical staff came in. It's just so fascinating to see all the moving parts from a patient perspective, like being in medical school and working in the hospital, you see things from a provider perspective, but being a patient, it just gives you like a whole different perspective of seeing all these different moving pieces. So like there are like at least three different nurses that came in throughout before my actual surgery. Like one did like some prep talk, you know, got me changed, being comfortable, and then another one actually started my IV, and stuff like that. So, and then we sat there and we waited. Honestly, I didn't know the pre-op was gonna be so long. I thought I was gonna be like maybe an hour or so, based on my other surgeries I've done. But this one was longer because one, there was somebody before me that was getting surgery, and you can only estimate the actual surgery for so long. So the doctor was still with somebody else. But so we were there until probably like almost 11 o'clock, honestly, almost 11 o'clock. That's when like the different parts, other parts of the medical team started coming in. So like there was a resident there. There was a plastic surgery resident. She was there. So she came and did her little spill. The anesthesiologist came in and gave his little spill. Some more nurses came in, and the plastic surgeon came in, and it was just all these things happening at the same time. And like they asked me, if I've ever had like complications with general anesthesia before. I didn't remember any of this. Thank God my husband was there. Told them that yeah, she's usually pretty nauseous whenever she undergoes general anesthesia. So they gave me like some anti-nausea meds before, and then they said they would give me some again right before the surgery, and then they gave me some right after the surgery. So that's now by 11 o'clock. Mind you, I've been there since 9. So that's now by 11 o'clock. Um, the anesthesiologist came in, talk about what to expect, all that. And then the doctor and the resident came in, and he did some markings on my boobs, to see exactly where they want to cut and blah, 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 all that. And then I had to leave my husband there in that room, and then they wheeled me around to the operating room, which that's when like I started getting like cold feet, and I was like, oh my god, I'm really doing this. I'm really, really chopping my boobs off. I'm really doing this. And I was just there, and I was like, there's no Matthew here. There's just strangers. I don't know. And I just started like getting in my head, and I was like getting really nervous and stuff. But by the time they put me in the operating room, and the entire staff was really nice. Again, it's just like all different people, the residents, the different nurses, the plastic surgeon, the anesthesiologist. It's like a whole house full of people there when you're doing surgery. And they got me comfortable and everything. And I remember like staring into the ceiling, and they were like, well, now we're gonna give you like, they gave me like the oxygen mask, and they were like, within like 5-10 seconds you should just pass away. Pass out, not away. Not away. You should just pass out. And I was like, okay. because like I was kind of worried because like one time when I did general anesthesia, I wouldn't fall asleep. So they ended up having to give me more and more anesthesia meds before I could fall asleep. But I was like, let me just not say anything. And yeah, I was knocked out. I was knocked out. So by then that was like probably like 11:30 that time. I was completely knocked out. And then oh my god, when you always see these videos of people waking up from general anesthesia and all the crappy shit they say. Yep. Yeah, that kind of happened to me. Um so like I remember waking up and I was in so much pain. Like it was like really bad. And I just started crying. Like I was just in and out when I was waking up from general anesthesia, but I started feeling the pain coming like more and more intense. And then I remember the nurse saying, "Honey, what's wrong?" They always call you honey. It's so sweet. The nurse was like, "Honey, what's wrong?" And I'm like, ASL, ASL. And she was like, "What?" I'm like, ASL, pain, ASL. And I was just bawling. So I am one of the co-presidents of side story. I'm one of the co-presidents of a disability group at my medical school. And one of the things that we're trying to implement this year is to conduct an American Sign Language classes, a medical American Sign Language class for med students. So med students can communicate with patients who are, deaf or hard of hearing and are not able to communicate with words, like others. So that is so funny because that's the first thing that was in my mind when I woke up from general anesthesia. So I kept saying ASL and I was crying. And the nurse was like, "Honey, what are you talking about?" And I'm like, "I really fucking wish I knew medical sign language right now because I could communicate with you and tell you how much pain I am in." And I was so serious. And I remember the nurse saying, "But honey, I don't know medical sign language, so I couldn't help you." And then I was like, "Oh, I'm so sorry. It's just like a class I'm trying to get implemented at my medical school right now, and I now see how important medical sign language is." And I got like so passionate talking about medical sign language the second I woke up from general anesthesia. And the nurses and everybody else was looking at me like, "Yup, we've seen it all." So anyways, after they like brought me back to the room now that I started with, and Matthew, my husband, was there waiting on me and stuff, and I was talking to the nurses, and I was still in and out of it. So, but I was talking to the nurses and stuff, and they're like, "Yeah, everything went well, and you have new boobs." And I was like, "Oh, I totally forgot." I totally forgot. I totally forgot. I went into the surgery to get new boobs because medical sign language was still on my mind. And I was in so much pain. So I think they gave me some more medication. I was like, it hurts so much. Like it literally really hurt. It felt like being sliced open, which is literally what happened. But that's exactly how it felt. Like my living flesh was just cut open. So like they gave me more meds and stuff like that. And I ended up having like a nice conversation with one of the nurses there, and I learned so much about her while being really high on meds and anesthesia stuff. And I started like encouraging her to like, "You should go take a vacation, you should go to Jamaica." Like I became such like a I went from being like a sign language advocate to like a Jamaican vacation destination advocate. I was like, "You should go to Jamaica, it's all inclusive and you get so much more for your money, and it's better than going to Florida and blah blah blah." And I just went on a rant. Like I went from one thing to the other. I was just talking about a bag of stuff. And so by the time I finally got home, I was probably like 6:30. So, and then my dad and my stepmom, they drove over to like help me and stuff, um, that evening and the next day. So yeah, that's it for the actual surgery. When I got home in the evening, honestly, I can't tell you. I don't remember most of the things that happened that evening. Even the Tuesday, I don't remember most of the things that happened, honestly. Um, because I was still recovering, and then I had all these drugs and stuff that I am still taking, most of them. But I'm super grateful. It's been Friday and I'm still here. I know, sadly, some people don't survive going under surgery for whatever reasons, but I'm super grateful that I'm still here. And then my next video, I'm gonna talk about what the actual what my rendition of recovery has been like since my surgery. So yeah, stay tuned.